Hello, my name is Willow, and today we're going to talk about Luigi Mangione, everyone's favorite tall Italian bisexual. In case you don't know who I'm talking about, here is a picture of him, and can we just appreciate this photo for a second? It was taken in the police station after Luigi was detained, which, he really showed up to the police station and said that's no reason not to serve, and I respect him for that. Although most of you have probably already heard about this man in one form or another, I'll give you a quick rundown of what happened for anyone who hasn't somehow. Is it nice outside? I haven't left my room in 7 days, so is the sun still there? Luigi Mangione is a 26-year-old Ivy League graduate recently accused of killing the United Healthcare CEO Brian Thompson in New York on December 4th, 2024, just before 7 a.m. in the morning. Okay, so it's not like totally recently because I got really busy. Don't come here for on-time content. It was a few months ago, but deal with it. He was later found and recognized in a McDonald's with a mask on in Altoona and arrested in the state of Pennsylvania for possession of a firearm, among other charges. Since then, he has had 11 charges filed by the Manhattan District Attorney and 4 charges filed at the federal level. Among the state charges was first-degree murder as an act of terrorism. He could also face the death penalty if convicted for federal crimes. As of now, trials for the state charges and the federal charges have not taken place, but Luigi has pleaded not guilty in all respects. The goal of this video will be to discuss if Luigi Mangione deserves the death penalty and if, in general, he deserves to be prosecuted for first-degree murder as an act of terrorism. I would like to preface that I am not an American nor a lawyer. My understanding of American law in respect to this case is based off of my own research, understanding, and logical reasoning. So there will obviously be some limitations. Just consider that when you're watching because, I'm not perfect. We all make mistakes. To begin, we need to talk about the most pressing circumstance of Luigi's case, the death penalty, of which federal prosecutors are reportedly pushing for. Now, I am no supporter of the death penalty for a multitude of reasons, ranging from it sometimes being an easy way out for individuals who have committed heinous crimes, and in other cases, it puts people to death that are innocent or at the very least don't deserve it. For this video, we are going to discuss the death penalty in relation to Luigi Mangione's case, without considering the ethical dilemma of the death penalty itself. Obviously, that is something that I do consider and that needs to be talked about, but that is a big enough topic to warrant an entire separate video. And if you want that, smash that like button, bang that subscribe button, and tell me in the comments. I can't say that seriously. I'm so sorry. Assuming he didn't kill one. Assuming Luigi didn't kill Brian Thompson and is successfully prosecuted for federal crimes, we will have successfully sentenced an innocent man to death. Assuming he did kill Brian Thompson, does he deserve the death penalty? Does he even deserve the charges of murder in the first degree, which make him eligible for the death penalty? Now, no one deserves the death penalty, as I've briefly gone into, but for Luigi specifically, assuming the death penalty is by a stretch of the imagination fair, does he deserve it? The way I aim to tackle this is by discussing the contrast of his case and Patrick Wood-Crusius's case. Patrick Wood-Crusius was 21 years old when he alone went to a Walmart in El Paso, Texas, and shot 45 people, killing 23 and injuring 22 others. Leading up to this attack, he posted a manifesto of white nationalist and anti-immigrant sentiments based around the Great Replacement theory, a far-right conspiracy theory in which white supremacists believe non-white groups are actively trying to replace and superimpose white individuals within places of power and general society. This man was given a plea deal in which he was allowed to escape the death penalty for his crimes. The reason I bring up Patrick's case is because Luigi Mangione is being mercilessly pursued as a terrorist and deserving of the death penalty for the currently inconclusive death of one man, who we will discuss later did so many worse things than Luigi ever did. But yet, a far right racist shooter responsible for killing 23 and injuring 22 other innocent civilians doesn't deserve the death penalty. With a note that there was sufficient evidence to prosecute Patrick. The plea deal wasn't just given to ensure a guilty verdict. By viewing the death penalty as the worst, most heinous sentencing an individual can have, the federal court of the United States is in many ways setting a precedent in which, if Luigi is convicted of the death penalty, he is not only more deserving of the death penalty than a mass murderer of innocents, but also displays the further concern of maintaining the status quo presented by the United States, a capitalistic body, than that of racist and discriminatory beliefs. In shorter words, this case presents the notion that anti-rich sentiments are equally or further prosecuted than that of anti-immigrant racist sentiments. The problem being that if this continues, where will the line be drawn? If Luigi deserves the death penalty for killing one person and Patrick doesn't deserve it for killing many, with the only difference being their sentiments, when will the simple sentiment of trying to rise against oppressors become a punishable offense? This is why this case specifically cannot be forgotten. The risk of moving on from Luigi Mangione could result in the further prosecution of individuals who simply share the same sentiments. To discuss if Luigi even deserves to be prosecuted for charges of first-degree murder, we need to discuss the American healthcare system and who Brian Thompson was in relation to this case. Again, assuming Luigi did kill the CEO, how bad is this really, is the question we need to ask. Simply, it looks like we're asking, is murder okay? But to boil it down to that ignores the social context around the issue. It ignores the systemic oppression created by the American healthcare system and capitalism as a whole. It ignores the deaths that you can attribute to the healthcare system, and specifically the policies enforced by Brian Thompson as a CEO of a health insurance company. Now, I don't like to throw out baseless accusations, so let's look at some lovely little facts and figures. In a study performed by Families USA, a nonprofit healthcare advocacy group, they determined that in 2006 alone, more than 26,260 Americans died directly because they lacked health insurance. Back then, there was roughly 47 million uninsured Americans. But this was almost 20 years ago. Is it still applicable? Well, in a study performed in 2017 by Wilhandler and Himmelstein, they concluded through various means that a lack of health insurance has continued to lead to increased mortality. It is worth noting that although this relationship has continued, the number of uninsured Americans since 2006 has dropped. Where it was 47 million, it is now 27.6 million. But does this mean healthcare is improving so that in the next 20 years or so it'll be fine? No, because coverage doesn't mean support. Individuals with public healthcare insurance, which made up 39.5% of people of all ages in 2022, as reported by the CDC, are only covered under certain conditions. For example, Medicare, which only covers individuals over 65 and or who meet the criteria for being totally and permanently disabled, keeping in mind the arbitrary nature of the statement. Are you disabled enough? Let someone decide if your life is hard enough to need help. I'm sure it'll go over great. Other programs are Medicaid, which covers individuals with low incomes, noting that an individual can still not make enough money to pay for private insurance and make too much to qualify for Medicaid. Military Benefits, Children's Health Insurance Program, or CHIP, and the Indian Health Service are all other public programs as well. But even if individuals are covered by public insurance, it doesn't mean it covers everything. With Medicare, individuals still have to pay for things like eye care, oral care, massage therapy, and routine physical exams, which are all important parts of an individual's physical and mental health and add up very quickly. Furthermore, it doesn't cover cosmetic surgeries, which can sometimes be necessary for a patient's health. The other problem is that even if individuals are covered, many still have to pay a percentage of the cost. Basically, being publicly insured doesn't mean you have proper access to healthcare. It just means you're a little less fucked than those that don't have any insurance. Now, the other issue, which is a whole other mess, is private healthcare. In the same record taken by the CDC in 2022, about 61% of Americans were covered by private insurance. This seems to be a good metric at face value, that 61% of Americans can access healthcare having far fewer worries of the cost of treatments. But this would be incorrect because, as I have stated several times, coverage doesn't mean support, and this is by and far the case with private insurance. Firstly, there are several ways to be privately insured. You can get business-sponsored health insurance, buy it personally, be supported as a government worker, or have a college plan. Now, the language itself is misleading. Let's say someone has business-sponsored health insurance. They still have to pay monthly payments, just at a reduced rate, which some people still can't afford. And even then, many of these plans don't cover a whole lot, meaning individuals will still have to pay a lot out of pocket. And even if a service is 100% covered, individuals will still have to pay a flat rate called a copay. Basically, in the land of the free, nothing is fucking free. And finally, probably the most aggravating of the problems is that even if you are lucky, and we are using that word very generously, enough to be able to afford whatever version of private healthcare you have, there is a limit to how much you can use it. And services that should be covered under the plan can sometimes be denied. And even if a part of the service is covered, the medication needed to treat it might not be. Well, where does that put us? What kind of effects can we see from this messy, poor excuse of a healthcare system? Well, because I am totally professional, I went to Reddit and found lovely stories, such as I had an ankle fracture surgery canceled this morning because he couldn't afford his deductible. This guy will literally never run or walk without pain again. He will never work construction again, and he has insurance that he pays for, and he still can't afford his necessary surgery. Or this post by a healthcare worker that perfectly encapsulates the idiocy of private insurance. I work in surgery, and my favorite is when insurance doesn't approve a surgery that by all accounts is necessary, even if it is elective, after a specialist has deemed the need to surgery. You know what an insurance agent can tell me about that surgery? A billing code. That's it. So in short, the health insurance of America is a fucking money-making scam, and a disgusting one at that. Now, I can feel you saying, Willow, I'm bored. Stop talking about numbers. And I feel you. I feel you. I didn't want to research this because it was fucking terrible. Now, stick with me here. When you have a vast amount of people worried about if they will be able to access necessary care, or if accessing said care will leave them in debt for the rest of their lives, and create a system where individuals who don't meet certain strict qualifications pay ridiculous amounts of money, you have successfully created a capitalistic system which values the life of an individual based off how much currency they can cough up. Most Americans don't benefit from the system, which is supposed to help them. But Brian Thompson did. Brian, as a healthcare CEO, directly profited off of an intentionally designed capitalistic system. Brian Thompson, by the act of being a CEO for a healthcare company, has not only enforced the policies which leave people less of themselves or dead, but has directly benefited from it. Brian Thompson is not an innocent man. He's far from it. His position alone that he chose to hold, was one that directly aided in the harm and deaths of so many fucking people across the country. To link this back to if Luigi deserves to be prosecuted for first-degree murder, he doesn't. Because this wasn't first-degree murder, it was self-defense. Self-defense is defined by American law as the use of force to protect oneself from an attempted injury by another. It is used in unlawful acts involving force, such as murder, assault, and battery. For example, in New York penal law, self-defense is justified when someone reasonably believes it is necessary to defend themselves against the use or threatened use of unlawful physical force. The danger must be imminent, meaning that they believed they had to act when they did to avoid the danger. The act of self-defense must be proportionate to the danger, and the person defending themselves cannot be the initial aggressor. Well, assuming Luigi killed Brian Thompson due to his participation in the healthcare system, Brian Thompson was the initial aggressor. He aggressed so many Americans when he upheld and produced policies meant to make sure individuals didn't get the care they needed and thus directly killed or prominently injured them. Brian Thompson was a danger to the lives of so many Americans, of which includes Luigi Mangione. Brian Thompson, if left unchecked, would have killed many more people. So tell me in what way this case isn't the self-defense of the general population against a man which, along with many of his rich CEO buddies, deserve to be prosecuted and jailed for their part in killing people. There is more that I could say, but I do not have the time nor the energy. I barely made it through writing and producing this video without breaking down crying, and in some cases I did. Thank you for watching, and I hope to see you again next time, hopefully discussing something more lighthearted.